Dear students, this particular game is of paramount importance. I hope you people are able to identify the couple of pictures on the screen. I have taken great pain in selecting the pictures and displaying them. The topic for the day is Hodgkin disease, and it can be asked as an essay or a short note, displayed as a chart, kept as a slide, and also a good number of 5-hour questions can be asked in this. Moreover, medicine, surgery, and pathology, all these subjects could expect theory questions from this. It is of importance. Kindly correlate with R.A.T.S. A case history. A 30-year-old female presented with a generalized weakness, a low-grade fever, on and off. And the doctor on examination found she was having a lymph node enlargement in the cervix and also in the supraclavicular region. The nodes were rubbery and not matted. No hepatomegaly or splenomegaly was there. Also, when pattern of fever was checked on admission, you found that there was a high temperature and then it lowered and so on it went on. Further, the lymph node was resected, sent for pathology examination. This is the gross and the microscopic picture that you people see. This can be given to you people in a chart or kept in a slide. What is your diagnosis? Describe the gross and the microscopic features. Mention the clinical features and the staging. What could be your clinical differential diagnosis? For that matter, even pathological differential diagnosis. So we'll come to these pictures. I hope you are able to digest the questions. The gross picture again. So this can be given to you people. It is a mounted specimen measuring dash into dash into dash centimeters. The external surface is smooth. What we are seeing is only the cut surface. Grayish yellow to pale grayish white. The cut surface is solid, homogeneous, and it produces what is called as a cut potato appearance. There are no areas of hemorrhage or necrosis. So this again is a cut potato appearance, and there are some lines that I'm seeing. These are incomplete fibrous septae. Otherwise, it is a solid enlargement of the lymph node. In some cases, however, it is not solid. If I touch it, it will be quite soft, almost like a fish flesh. So the gross appearance can be described as a cut potato appearance or a fish flesh appearance. It is glistening and shiny in this case. Again, homogeneous, no necrosis. It is reddish here because they have just now dissected the specimen. Microscopically, this is what is there. You people will be given a clear picture of this, or even if there is a slide, this will be focused. I am finding a large cell. How do I say it's a large cell compared with all the other cells? It is binucleated. The white ones are the nuclei, and the dark dots are nucleoli. These are called prominent eosinophilic nucleoli. And the appearance is an owl-eyed appearance. The cytoplasm is pale eosinophilic. So this is the classical picture of a R.A.T.S cell. This itself is a question for you people. And compare the owl-eyed appearance. This will be there. It is a difficult slide for you people. It might not be kept, but we should know. So these are the R.A.T.S cells. In this, I am finding there are 3 nuclei, okay, and they are having eosinophilic nucleoli. That is important. And there are some well circumscribed cells. They are pale. They are the histiocytes. There are small dark cells which are the lymphocytes. And in some, there are ovoid cells which are plasma cells. So I am finding a mixed population. We call it a pleomorphic population of cells. This is a tumor one, but in the background I am finding histiocytes, lymphocytes, plasma cells. Sometimes eosinophils also can be seen. So this is called a pleomorphic population. A second point will be total effacement of architecture. If you go to my classes on lymph node metastasis or lymphoma, you will be able to recollect this. The lymph node shows an effacement of architecture. I told you earlier, architecture means relationship of one part of the tissue to another. There are no lymphoid follicles. R.A.T.S cells are seen. So quite easy for you people, memorize this. You might even be able to answer a theory question. The signs and symptoms can be there. You find there can be a fever, there can be a swelling because of the lymphadenopathy, there can be night sweats, weight loss obviously. Anybody who is sick will not be having a good appetite, breathlessness, feeling of weakness, etc. And the classical one is, as I told you, a period of fever and a drop. This is called the Pell-Epstein type of fever, which can be seen in Hodgkin's. Generally, it is a low grade, but you will not be getting a fever with rigor, etc., as in malaria. And this is a staging. This I have given pertinently because there is a question, how do you stage this disease? So in this case, it is totally absent. A means absent. In stage 1, I find that there will be a single group of node or a single node that is present. And in stage 2, I find that there can be two different groups of nodes. And in stage 3, I find that there can be nodes or organs on either side of the diaphragm. And in stage 4, there can be hepatosplenomegaly and bony metastasis can be there, involvement. So this particular one, I would like you people to read. This is called the R.A.T.S classification. Single group of nodes on either side of the diaphragm along with organomegaly and involvement of bone. So this is the description. I would like you people to do it on your own. Don't hesitate. It is an ovoid structure and I find the external surface is smooth, the cut surface is glistening, it is solid, and there are no areas of hemorrhage or necrosis. It can be a fish flesh appearance. And these are some of the variants. Sometimes you can get multinucleated cells, there can be mummified cells, uninuclear cells, etc. The variants of R.A.T.S cells I have explained in detail in my class on R.A.T.S. Kindly go and refer. So between lymphoma and tuberculosis, both are questions for you people, both are specimens for you people. How do you distinguish? Lymphoma, there is a greater enlargement, they are discrete, there is no matting, cut potato appearance or a fish flesh appearance. Tuberculosis, again, the nodes are matted. I find that they are adherent to each other. This is because of perinodal fibrosis. Perinodal fibrosis holds the nodes together. This is called matting. Enlargement will be mild and there is caseous necrosis. Look at this irregular map-like area of caseous necrosis. Microscopically, you will see a granuloma. And both are university questions. If you answer one well, definitely the examiner will ask you the other. So kindly be fluent and refer R.A.T.S. The importance is given over here. Anything can be asked for you people. See you in game 57.